Welcome to The Explainer. Today, we're going to talk about something you do, about 20,000 times a day, and you probably don't even think about it. I'm talking about breathing. But what happens when that simple act gets difficult? We're going to explore the medications that help keep our airways clear. And to do that, we've got to understand the system itself first. So, let's start with this really cool analogy. I want you to picture your entire respiratory system like a big tree, but just flip it upside down. The main trunk, that's your trachea, your windpipe. It splits into two big branches, the bronchi, that lead right into your lungs. And from there, it just keeps branching out into this huge, complex network. First up, let's actually follow the path of a single breath, just to see how this incredible machine really works. Okay, so you take a breath in, right? That air comes into your nose or your mouth, and right away it gets filtered, warmed up, and humidified. Then it shoots down your trachea, that's the trunk of our tree, splits into the two main branches, the bronchi, and then from there it just keeps dividing into smaller and smaller little passages called bronchioles. It's like going from the main trunk all the way to the tiniest twigs. And at the very end of this journey, we get to the leaves of our tree. These are called the alveoli. And honestly, this is where the magic happens. We're talking millions of these tiny little air sacs where the crucial exchange takes place. Oxygen gets into your blood, and the waste, the carbon dioxide, gets kicked out so you can breathe it away. So how often does this happen? Well, for the average adult, this whole cycle repeats about 12 to 18 times every single minute. And this is what's really interesting, that number is not a one-size-fits-all, not at all. It changes a lot depending on how old you are. Just take a look at this. An adult, like we said, is breathing maybe 15 times a minute. But a child, they can breathe nearly twice as fast. And a tiny infant, wow, their rate can shoot all the way up to 60 breaths per minute. It's just a wild reminder of how our bodies adapt as we grow. Okay, so that's the system when everything's running smoothly. But what happens when it gets attacked? Let's talk about some of the usual suspects. Things like the common cold and allergies. They can feel pretty similar, right? Stuffy nose, sneezing. But what's actually going on is totally different. A cold, that's an outside invader. A virus comes in and sets up shop. But allergies, that's an inside job. It's your own immune system basically freaking out over something that's actually harmless, like pollen or dust. And yeah, the list of things that can go wrong is, well, it's pretty long. It can be something simple like rhinitis, that's just a fancy word for inflammation in your nose, or it can be much more serious, like chronic conditions like asthma, where your airways actually squeeze shut, or COPD, which is a group of diseases that make it permanently harder to breathe. But here's the good news. For a lot of these problems, we have a whole arsenal of defenders ready to go. So let's meet the heroes of our story, the medications that are designed to fight back. And the key thing to get here is that each of these drugs has a very specific job to do. They aren't interchangeable. Antihistamines, they're for allergies. They block that chemical reaction. Decongestants, their whole mission is to shrink the swelling in your nose. And bronchodilators, they go straight to the source, relaxing the muscles in your airways so you can get more air in. Okay, let's talk about coughs, because this is a big one that people get wrong. You have to pick the right tool for the job. An antitussive, think anti-cough, that literally tells your brain to stop coughing. It's for those annoying, dry, hacking coughs. But if you've got a wet, productive cough with a bunch of gunk, you want an expectorant. Its job is to thin out all that mucus so you can, expel it, get it out of there. And when you're dealing with something chronic like asthma, the game plan has two parts. First, you've got your daily, preventer, or maintenance inhalers. These are often corticosteroids, and they work over time to keep inflammation down. Then you've got your rescue inhaler. This is for when an attack is actually happening. It's a fast-acting drug that opens your airways up right now. All right, so let's get really practical now. How does all this information actually help you? Let's talk about your personal health toolkit and some things you absolutely need to know. So you've probably had this happen. You go to the pharmacy for some of that good, strong cold medicine, and the pharmacist has to get it from behind the counter. Ever wonder what that's all about? Well, the whole story comes down to one ingredient, pseudoephedrine. It's a fantastic decongestant. It really works. The problem is, that same ingredient can also be used to illegally cook up methamphetamine. So, to stop that from happening, there are regulations that limit how much you can buy and require it to be kept behind the counter. Okay, and here is a super important warning, especially if you use those decongestant nasal sprays. Listen up, this is for you. If you use one of those sprays for more than 3 days straight, you can actually trigger a pretty nasty phenomenon known as rebound congestion. And what happens is, it's a crazy paradox, really. The very thing you're using to clear your nose starts making it worse. Your body gets so used to the medication that when it wears off, the swelling in your nose comes back with a vengeance. It creates this awful cycle that can be really hard to break. And that brings me to my last point, and honestly, it might be the most important one of all. Your medicine can't work if you don't use it right. This is especially true for inhalers. Seriously, using one correctly is trickier than you think. And if you get it wrong, that medicine isn't getting where it needs to go when you're having an attack. So it's worth asking yourself, do I really know the proper technique for my inhaler? Taking a minute to have your pharmacist show you just to be sure, that could literally make all the difference.